It's a great pleasure to speak to you today. It's amazing how techniques make it possible to meet from all over the world in one session in India. And I'm already looking forward to physically come to India again in 2024 for the meeting of the International Society of Ocular Oncology in Goa. Well, one subject I'm now going to talk about is eye color and uveal melanoma in a collaborative study with Carol Shields. It takes a village for treating a patient. It takes a lovely international community to collaborate on obtaining research data. And these are the different PhD students who from many parts of the world who collaborated in Leiden to get the data on eye melanomas. These are several examples of an anterior chamber tumor and posterior chamber uveal melanoma. And in some parts of the world, this disease is more common than in others. It is quite common, relatively speaking, in Western Europe. And uveal melanoma is a malignant tumor of the eye, mainly in adults, average age 65. It's not frequent, but it has a really very high mortality rate of 50%. And as opposed to retinoblastoma, this has really not decreased over the last 50 years. There are quite a number of risk factors why one can develop this malignancy. The main thing is that people get older, and because they get older, they get different types of cancer, and this is one of them. A nevus of Ota is also a risk factor. And then the many risk factors have to do with Northern European ancestry. Blonde hair, lack in the ability to tan, high numbers of freckles, high numbers of moles. And this was summarized by one of my students recently. Well, one of the things that one has that has a risk is eye color. It's defined by at least 6 genes, and biochemically, different eyes with different colors have different biochemistry. In the light-colored eyes, when they are exposed to the sun, there may be more reactive oxygen species and stimulate more mutations. But almost all uveal melanoma have the same type of mutations in GNAQ, GNA11, that occurs also in nevi, and then a series in uveal melanomas. This is a display of different eye colors and the world. Blue eyes are especially seen in Northern Europe, but also in Australia and the northeastern part of the United States. Blue eyes are especially common in Europe and in the Netherlands, which is one of the most northern countries of Northern Europe. If one looks at different publications about uveal melanoma, then one can compare the iris colors in uveal melanoma cases with patients that with people that do not have an eye melanoma. And when you go down the left-hand side and you look at blue and gray, then 61% of uveal melanoma patients have blue-gray eyes and only 50% of the controls, while the opposite was true for brown eyes. Many more brown eyes in people without an eye melanoma. Now, when you see this, the first question that comes up, do people with those blue eyes have a higher risk for developing metastases? They have a higher risk of getting this tumor. And I already mentioned several items that occur for a higher risk of developing an eye melanoma, but older age is also a risk factor for developing metastases or a large tumor size, and specific chromosome aberrations, loss of one chromosome 3 or a specific aberration in chromosome 8q. Important prognostic factor is tumor size. The larger the tumor, the top line, the less chance there is for developing metastases, and the larger the tumor gets, then the higher the chance of developing metastases. So size is really important. Then I already mentioned chromosomes. Loss of one chromosome 3, a typical pattern, higher risk of developing metastases, or the RNA expression patterns, class 1 and class 2, often used in the United States. But for the cost, we do not use that. Monosomy 3, very clear distinction between a good prognosis at the top and a bad prognosis at the bottom. The different genetic prognostic factors lead to 4 groups, A, B, C, D, that either have a mutation in specific genes or the already mentioned chromosome aberrations. Monosomy 3 is the very bad situation with the chromosomes. So group C and D share that they have loss of one chromosome 3, and both are the class 2 tumors with bad prognosis. So do we see differences related to eye color? We had a database, and the reason I started to look at this was not some theory, we found that out later, but I am a cornea doctor, and I wanted to see the eye melanoma patients. So I joined the clinic of my colleague, Marina Marinkovic, and after seeing 11 patients, I asked her, do really all the patients have blue eyes? Because in my cornea clinic, I have a mixture. But after I had seen 11 eye melanoma patients, I had only seen 11 people with blue eyes. So then we started to check, and luckily, the registration system also includes eye color. So we had 412 patients with eye melanomas, and we knew the chromosome status. So we determined whether eye color had anything to do with prognosis. It did not. Here you see the 3 groups. Blue is blue eye color, green is green eye color, and brown is brown eye color. So that did not make a difference, that it was not significant. But one we know that chromosome 3 is so important, we also looked at that. And now we separated the 3 groups, the blue eyes, the green eyes, and the people with brown eyes. And we looked at the effect of chromosome 3. What is the effect of chromosome 3 on the survival of the patient with an eye melanoma? As I said, 50% of our patients will die. But there was a clear difference between the groups with the eye colors. When you look at the patients on the left with the blue eye colors, you see what we always see in our studies. The red line here is the patients with monosomy 3. They have a worse survival. Then you go to the middle and you see the patients with the green eyes, typical, by the way, for Northern Ireland also, and you see an enormous difference in survival. Patients with monosomy 3 and green eyes actually did very well. And when you go to the brown eyes on the right, you see that there is no difference in monosomy 3 survival and whether they have monosomy 3 or not. Well, this has not been published before, and we looked around all over the world whether people had similar databases. And then there is one fantastic database and a very generous researcher clinician, the Carol Shields and the whole Shields group, and they have registered eye color as well. You also have to be in a certain part of the world, because as I already mentioned, the northeastern United States have a mixture of blue eyes and brown eyes, like what we have in Northern Europe. And we worked together to study this, and we knew that they had these data because there was this gorgeous paper from the Shield group in the Indian Journal of Ophthalmology last year about the Cancer Genome Atlas data. So we then looked at the effect of having blue eyes or brown eyes and the effect of the 4 different groups that I already mentioned, the A, B, C, D. C and D have the high malignancy, and on the left you see people with blue eyes, and these are the typical graphs that you'll find in most of the papers from the Northern European and Northern American centers. the higher the degree of malignancy, the worse the survival. But when looking at brown eyes, the differences were much less, and the 4 categories did not separate as well as they did with blue eyes, as to what we are used to. Now, you are in India. What does this mean for people in Asia? Of course, having a brown eye does not prevent one from developing a uveal melanoma. And there are some superb studies that describe the occurrence in India and Asia of choroidal melanoma. I advise you to certainly read these two from Dr. Pal and Dr. Manshikoda, written together with 2 other panel members, speakers today. And the incidence in Asia is much lower than in Europe, but there are still quite a number of cases. There's a difference in the age. In Europe, the mean age at presentation is 58. In the Netherlands, it's over 60. But in Asia, it is between 40 and 55 years. And it seems that survival is better. 2 studies, including from my friend Krishna Kumar, showed that the risk for metastases is increased in India with epithelioid tumors, loss of BAP1, and inflammatory phenotype, very similar to what we have described here. But the one essential thing is that it is essential to look more, as Dr. Manshikoda has written. Studies are needed to determine how the different prognostic factors, especially the genetic ones, affect Asians with uveal melanoma. And other conclusions: people with blue or green eyes have a higher risk of developing a uveal melanoma than those with brown eyes. But Asians should beware of the nevus of Ota. That seems to occur there more often, and more often in association with uveal melanoma. And chromosome aberrations, as seen in Europe and United States, have more effect on survival in green and blue eyes than in brown eyes. And why would you like to know the chance of survival? Patients want to know what their chances are, whether they have to settle their estate and have the risk of dying in a short time, but also for prognostication for adjuvant trials, which will in the not too distant future be developed, similar to that they are now for cutaneous melanoma. And many thanks to our LUMC oncology team and to my collaborators in the lab, and of course to Dr. Shields and her fantastic group. And I invite you to come to the ISOO 2022 in Leiden in June. And I was very happy that I could distribute nice travel grants to quite a large number of superb Indian doctors who submitted the superb abstracts. We did that yesterday. And thank you very much for your attention.